So your physician has just recommended to you Lawn Surfer. We call it TAS 102 as well. Now this is an oral medicine, and it is a new kind of chemotherapy. It's kind of a cousin of the 5-FU or Xeloda capecitabine that you had before, but it is different. Now it's oral, which is nice. It frees you up from having to come to the infusion unit. Although you'll miss all the team down there, you'll get a break from all of that and coming back week in, week out. You take it in an unusual schedule. You take it for 5 days in a row and take 2 days off, and then another 5 days in a row, and then another 2 days off, and then we give you 2 weeks for good behavior. Now you'll feel pretty well, most patients do, while they take this medicine. A few people will get some nausea and some GI upset, so don't be surprised if you get a little of that, but most people can control that with our good anti-nausea medicines. So most folks feel pretty well. But the problem with this medicine is it drops your blood counts, and maybe to this point you haven't really had a super low blood count or had to come into the hospital because of fever and worrying about a low blood count. So this does this with this medicine. So your counts can go below where it's safe and you can't fight off an infection. So be real sensitive, not hyper, not crazy about your temperature, but if you feel sick, if you feel your temperature go up, always in the afternoon, by the way, take your temperature, and if it's over 100, 100.5, sorry, call us, whoever your team is, and tell them. And they'll probably have you come to the emergency room to have that checked to make sure that you have enough white cells to fight this off. Now most folks don't have that temp, but you might come back to begin the second round of the treatment and find that your counts are too low to start. So don't be surprised if you have to delay an extra week, or sometimes physicians like to give growth factor shots that kind of goose your immune system and your white cells so that they don't go down quite so low or stay down so low. So this medicine controls the growth of cancer in a high proportion of patients. It has a fairly low side effect profile except for this mild nausea and the low blood counts. And your physicians recommended it to you in the hopes of extending your survival and having your quality of life remain high so you too can make it to that next important event in your life. You know, we know this patient a lot. You know, you've talked to them 1,000 times, right? You know their families, kids, all of that, right? We have a sense of their social support. So now we come to the next decision of, all right, we've got 2 agents in refractory setting. We have TAS 102, we have regorafenib. You know, how do you go about picking a patient who's the right one for what drug?
Sure. No, as you mentioned, after a while, patient become to part of your own family, and actually you become part of your own family, and you know them very well, and even you start to know like your life, your kids, your wife, all that stuff, and vice versa. And one of, I think, of the important benefit of that is that you can tell what's important for them, even without them saying that. And as a clinician, one thing you want to make sure, yes, your drug will work, or hopefully it work, but also you want to make sure the side effect fit their lifestyle profile, especially in that kind of stage. The refractory, they already received a lot of treatment, as you mentioned. So, for example, if I have somebody who's like to play guitar, I might choose not to give him Stivarga, not because of anything, but because of the hand-foot syndrome that affect his lifestyle. I had a patient who actually was going to play in a concert, and that was a determining factor. If somebody he kept having infection one after the other and low count, I might shy away from losing Lawn Surf because of the count problem. So you have to tailor your therapy to what fit really for that patient. I think, in my opinion, colon cancer is a family name. I always think every individual person like is the son and daughter that shares the same family name, but it's different in own character.
Yeah. I know, Monica, you have a lot of experience with both these drugs and managing it, you know, from your side, from the nursing side. Are there issues that sort of distinguish where one patient you think might be better Lawn Surf, one patient might be better Stivarga?
I think it's kind of like Dr. Salem said, a lot of times it comes down to side effects. So you're about to start the medication called LonSurf, and this might be something totally new and different from you. You're used to going to the infusion center, the nurse gives you your medication, you go home. But now you're at home, you have these pills, it's kind of all in your hands. And this medication is a little bit hard with the dosing. You take it 5 days on, 2 days off, 5 days on, 2 days off, and then 2 weeks off. So number one, I want you to make sure that you write down the days when you're supposed to take the medication and at what time. You're going to take tablets in the morning and at night. So make sure that you remember the dosing. Another important thing is sometimes it's hard to remember. So if you don't know if you took a dose, don't take it again. That's really important. You don't want to double dose on the medication. Something else is that you might be experiencing some side effects, a little bit of nausea, some vomiting, things like that. If you have any of that, those are side effects, but it's important to communicate those to your care team. The really, really important thing that I want you to remember with this medication is that if you have a fever, and I tell my patients 100.4 or greater, if you have a fever like that, I either need you to call us right away or just go right to the emergency room, because if your white cells are low, you might be at risk for infection, you might need some IV antibiotics.